And then the number 4, we have to administer the medication via nasogastric tube. The first one, the third one is food, and the fourth one now is the medication. The purpose is to properly, correctly administer medication via the nasogastric tube.
So for the materials in this procedure are, you need to have your correct medication, a septo or the tummy syringe, which we have already right now, your emesis or the kidney basin, and then your disposable, which I'm wearing right now, disposable gloves, and then water, and then you also need your stethoscope. After you have water, stethoscope, and the disposable pad or the towel, which is already in the patient, sterile gauze, and lastly is a rubber band.
And as a nurse, following the basic guidelines of the nursing process, same. So I'm going to assess and check the correct placement of the tube, and then also we're going to check and identify the medication to be given by looking at the patient's chart and the doctor's order, and then check to see whether the medications to be administered come in the liquid form. Capsules and pulverized tablets must be administered together with water. And for the planning, gather your equipment and materials.
And then for the procedure or the implementation, make sure to introduce self and verify the client's identity using the agency protocol, same, and then explain the procedure to the client as always. Perform hand hygiene and don gloves, which I already did right now. Using the septo syringe, draw up to all medication to be given, and also draw up syringe containing 15 to 20 ml of water. And then assist the patient. Make sure to assist the patient in a Fowler's position in bed or sitting position in a chair. If a sitting position is contraindicated, a slightly elevated right side lying position is acceptable. If the patient has continuous tube feedings, close tube feeding, pump temporarily, and then check tube placement. Fold the tube over the clamp with fingers. Disconnect tubing for feeding from NG tube. Insert tip of a septo syringe into a gastric tube. Release the NG tube. Pull plunger back using a constant gentle pressure to check the residue. After noting the amount, replace the residual feeding back into the stomach. Fold NG tube over the clamp with the fingers. Remove a septo syringe. Apply syringe with medication to be given. Release gastric tube and administer medication. Clamp the gastric tube with fingers. Fill the syringe with water and flush the tube with a constant delivery rate. Folding tubing back over the clamp with fingers. If more medications are to be given, repeat actions 6 to 7. If no more medications are to be given, flush tube with 30 ml of water and clamp gastric tube, remove gloves, and now perform hand hygiene.
Then for our evaluation, make sure we have to evaluate the patient's risk tolerance to the procedure and reaction to the procedure, bowel sounds, and regurgitation. And then for the documentation or the recordings, make sure to record the amount of water used to flush, tube, and document on the medication administration record.